My name is Sherry Guess, and this is the Heavily Meddled Podcast. On this podcast, I interview patients, medical professionals, and industry insiders, having important discussions regarding the all too commonly experienced but lesser identified symptoms of hypersensitivity to metals contained in implanted medical and dental hardware. These metals often cause a variety of dysfunctional immune responses, chronic pain, and other syndromes that fly under the radar of most patients and physicians. During these interviews, the patients and I discuss ideas for managing symptoms, share personal lifestyle modifications, and talk about how to advocate with and educate providers pre- and post-surgery, along with options found for implant removal and the how-to of adverse event reporting. This podcast does not give medical advice. From time to time, I may interview medical professionals that render personal opinions you can use to follow up with your individual provider. Let's roll. Hello, metalheads, and welcome to the jungle. Thanks for coming back to this edition of the Heavily Meddled Podcast. You guys are going to notice I'm a little chill today. I'm going to introduce our guest in just a minute, but I am chill because I performed 3 sold-out concerts in an opera center yesterday, and I'm not getting out of stretchy pants today. And today is all about self-care. You're going to be really excited about this episode. By now, many of you have heard about the devastating news of Luigi Mangioni, who was a man that was reportedly suffering for years with untreated medical conditions. He recently shot and killed a prominent healthcare executive, and we are not here to justify or condone violence in any way. But this episode is going to ask what happens when the people we're supposed to trust for healing end up harming us, and when we're told it's all in our head, when we're dismissed, when we're re-traumatized and gaslit by the very people meant to help. How do we survive that? And more importantly, how do we heal? So today we're talking about medical PTSD and how to reclaim your voice and your sanity in a system that often erases both. I'm honored to welcome our guest today, Megan Nichols. Welcome, Megan.
Hi. Hello. Thank you so much for having me.
You're so welcome. Megan is a licensed clinical therapist. She switched her path from pre-law to social work at Baylor University, and purely on faith, Megan earned both her bachelor's and master's degree in social work. She began her career in inpatient behavioral health and later expanded into home health and hospital settings, along with community education. And since 2016, Megan has built a thriving clinical practice. You're trained in EMDR. Some of these things I don't even know. EMDR, DBT, EAP, and the Daring Way curriculum. Why don't you just tell us, along with your professional pursuits, who you are as a person, what you love, what you don't love, what your pet peeves are. Let us know who you are a little bit.
Okay, perfect. You did a great job with the trajectory of my career and how I got to where I am. I also experienced a journey with autoimmune struggles and experiencing some pain, experiencing the way that trauma had manifested very physically in my body, and hit a lot of roadblocks in trying to identify what was going on and get the appropriate treatment. I am so grateful that I found social work, because in all of the learning that I've done with trauma work, and specifically related to this conversation, Dr. Gabor Mate is going to be somebody who I reference a lot, and also van der Kolk and the kind of conceptualization that the body keeps the score. I was able to do a lot of my own healing in my journey of becoming a therapist. And of course, I think for us to be good practitioners of mental health, we've got to have our own reality with our experience with wellness in an overall dynamic, right? We got to be healthy to help people be healthy, for sure.
Correct.
I'm a single mom of 3 kiddos. They are 8, 10, and 13. They keep me very busy and very full of joy. I always say that motherhood is the most beautifully tragic experience in life, right? We all kind of fall apart with motherhood. Yeah, we fall apart in all the ways, physically, emotionally, with motherhood. And then we have to learn how to rebuild that to be a good influence on them and all of that. My practice, my babies, that keeps me busy. Music is a big part of my life. So when you said that you performed, I was like, can you tell me more? Tell me more about you, Sherry. I don't even know.
Oh, some of the people know my background is I came from the world of heavy metal and rock and roll, and I did publicity and PR, and I was a journalist and did all the heavy metal things. But I like to joke that I'm a little bit country, a little bit rock and roll, except I'm not a little bit country. I'm a little bit classical and a little bit rock and roll. So I
Love it.
actually perform in the Dallas Millennial Choirs and Orchestra. It's the largest community choral organization in the world, actually. They've got choirs
That's
in, I think,
incredible.
6 states now, and we perform usually spring and Christmas. And this was a big performance last night in the Winspear Opera House
Mhm.
downtown, and it was really incredible. So
That's
super fun.
amazing.
Yeah,
I
what kind
love
of
that.
music
What
do
a
you
good
do?
outlet. I used to do the country Opry circuit when I was like a kid, 16. Now I have an album actually that was my healing journey when I went through a divorce. And it's very alternative. It's very rock, very like big vocals, lots of
Is it released? Like
emotion.
we can link to it in the show notes and
Yeah,
people can buy it
yeah,
kind of thing? Okay,
totally.
go check
I've
out
not
Megan's
done a
album,
thing
y'all.
with it. I haven't done a thing with it outside of just put it out there, and it was my own outlet, right? So I think music is such an
Awesome.
important outlet. Yeah, I
Awesome.
love that. I
Awesome.
love that we share that.
Perfect. Let's jump into the content of the
Yeah,
episode. Talk to me for a
sure.
minute about what medical PTSD is. Can you start by explaining that and how does it differ from other types of trauma? Because I really want to focus on the medical part. Like, how does it show up in daily life and how does that look in real patients? Because you actually work out of a medical clinic, right?
I do.
I think to really understand medical PTSD, I think it'll be nice for me to give the rundown that I typically give clients, or if I'm speaking about trauma, just a basic understanding of what trauma is. What a lot of people don't understand is that trauma is in the eye of the beholder. What is traumatic for me could be very different than what is traumatic for Sherry or whoever else we're talking about or whatever situation we're analyzing. Some people have a very high tolerance for chaos or for struggle or for grief or for stress in general. And some people, they're not conditioned to deal with trauma. Right. And I'm
Yes.
not saying it's necessarily a strength to be conditioned to deal with trauma, but that's just life, right? The human struggle is full of it.
I
So,
have that strength. I wish I didn't have that strength, but
and I think most therapists probably have that strength. There's a reason we're in the field. I think remembering that a car accident could be deeply traumatic for one person and not for the other. A divorce could be deeply traumatic for one person and not for the other. So we just have to remember that pain is not something that we size up. And I think that comparative analysis of this person tolerated that just fine, that's a mute point for me.
completely relative.
Yeah, I
Completely
try
relative.
really hard to remind people to not size up their story next to somebody else's or to not say, I read about people going through these horrible atrocities and I just feel silly for feeling what I'm feeling. And I want
Mhm.
people to remember that your feelings are valid, your experience is real. I meet all my clients where they are, and I really encourage them to meet themselves where they are with compassion and understanding. We don't need to justify or size up. I also think it's important to say that just because people say that's trauma informed or that's a somatic response, I think
Mhm.
people unfortunately feel like maybe that means it's not real or that they're just creating this reality. While perception does have a lot to do with our ability to move with pain or move with trauma, it's still very real. The
Sure.
signals that our brain sends to our body.
I've only done one other mental health episode before, but I had Dr. Kim Duramo on. Are you familiar with her work? The Institute of Mind Body Medicine. So I had her on. I think it's been proven in that realm that the brain can actually perpetuate symptoms. Just because it can doesn't mean it's perpetuating every symptom, though. And I think that's where a lot of the medical patients come down with me and myself. If the doctors don't know what's wrong, it's, hey, we think it's psychosomatic or it's in your head because your tests look normal and it might be something outside of our paradigm. For selfish reasons, I think a lot of my followers really relate to that. We just,
Good.
metal hypersensitivity doesn't show up on a lot of testings. A lot of doctors are not trained in that. It is very traumatic.
I think the struggle is, especially when we're talking about pain or PTSD or metal sensitivity, the doctors that you typically go to, like your family practitioner or internal med or pain management, they're not really well versed on mental health. I think that it's wild and it is such a glitch in the matrix
Mhm.
that's healthcare for us to not embrace that mental health drives everything. Pain and
Sure.
emotion overlap in the brain. Serotonin and dopamine have a direct impact on our experience with pain, just like it does our experience with depression. They are exacerbating realities. And so for us to ignore or to minimize the fact that mental health absolutely impacts our physical well-being is such a myth. I hope that people like you continue to educate the world to help people understand that.
Why do you think that being dismissed by a medical professional has a particular really deep cut?
I think that's an important question. I think we glamorize
Mm-hmm.
certain professions. I think there's also this level, it's such a vulnerable experience to go in and to say, hey, this is what's happening. This is what I'm feeling. And for somebody to be unenthused, unexcited, or even dismissive feels really painful.
We put these doctors up on a pedestal. I say 50% graduated in the bottom half of their class. What happens emotionally and psychologically when somebody's repeatedly told you're fine when you're clearly not?
Yeah. Unfortunately, a lot of the people that are pursuing a diagnosis when it comes to chronic pain or metal sensitivity or something, people aren't really embracing, like your fibromyalgia, or there's just a slew of diagnoses that we could talk about. But that doctor, that physician is probably not the first person that's invalidated their experience. And we are tribal animals. We are built, we are hardwired for connection. When we're in a stress response, the chemicals that are released in our brain are cortisol, norepinephrine, oxytocin. Oxytocin is something that begs for connection. We need each other. Like, we need somebody to say, it's going to be okay, I got you. You're already very stressed about even experiencing what you're experiencing. And then you add that extra stress, that additional level of stress response on top to go sit and talk to somebody who you've arguably put on a pedestal. And then they say, no, I'm unimpressed. That's in your head. That's a psychosomatic reaction. Here's an antidepressant. It feels gutting. It feels invalidating. It feels like your reality is not real. And then you start to gaslight yourself a little bit. You start to say, maybe this isn't real. Maybe I'm making it up, or maybe I'm insensitive, or maybe I just don't have a tolerance for pain, or maybe everybody else is healthier than me, or everybody else is more grounded than me. And you fall into this isolative experience from that invalidation that is the antithesis of who we are as human beings. We need each other, and we need somebody to tell us it's going to be okay. Even if the doctor says, you know what, I don't have the answers, but we'll figure this out. I'm here with you, and we're going to figure this out. Keep talking.
And how often does that not happen? In the wake of the Mangioni incident, what does it tell us about the desperation that people feel in the current healthcare climate?
Going back to the idea of invalidation and disconnection, when that is placed on top of a feeling of continued pain, no relief from said pain, or whatever symptomology that person is experiencing, not just Mangioni specifically, whether they're experiencing seizures, whether they're experiencing migraines, whether they're experiencing chronic back pain, and it's limiting their capacity to work or to create a life that they love and they feel plugged into. And then when you place the financial burden of all of that on top, because these journeys are stressful and not cost effective, when insurance is denying everything because none of the blood tests came back or none of the MRIs came back. And so you're getting told no. Not only is your pain being invalidated, but your hands are being quite literally tied in your own ability to pursue healing.
And even if you find an answer, I've probably spent literally conservatively, and blessed that I was able to do so, $500,000 in medical bills. Even if you have a diagnosis and you have an answer and they have proven it's not in your head, there's real grief there. But we'll jump to that in a minute. But going back to the violence thing, when you feel like you have no way out and you're a caged animal in your pain and in your gaslighted,ness, if that's even a word.
I'll take it. That word works. But I think you get a feeling of desperation if you think about, I couldn't tell you the exact statistics right now, but there is such a frequently tied financial distress reality to suicide, right? I think when you have that level of desperation and you're not thinking with your prefrontal cortex, you're 100% in your primal brain. Like, throwing a temper tantrum is, we don't fault children for that because they don't have that reasoning capacity. But when somebody, even an adult, has been invalidated and disconnected from anything that feels like hope, that sheer hopelessness, I think can drive people to cope in really concerning ways. Right.
And so there's a grief there, and it's not just a grief that's on our health, but for trust and time and safety. And then what does the process of grieving look like when the loss isn't a death, but it's, for example, your belief in the medical system, right? There's got to be anger there in a system that has failed you and maybe time and time again.
Absolutely. Absolutely. Grief is such a dynamic and very personalized experience, and it comes in waves. And I think so often, like the image I'm getting as you're describing your own emotional reaction to being disappointed by the healthcare system, and even talking about this situation specifically, it's when you get knocked over by a wave and you're scrambling and you're fighting the wave and like you're trying to get on top of it and you're grasping at everything and you just get breathless and you don't ever get your head above water. And I feel like grief is one of those things that you have to be able to learn to flow with it. You have to be able to ride the wave because you're never going to beat that wave. It's going to take you down.
So then that would look like sitting with those feelings, acknowledging them, and not maybe labeling them as good or bad, but just a feeling in a moment that will pass.
Right. It's not going to last forever. That moment is not forever. But when you also take a moment where not only are you experiencing grief from that betrayal, but you also don't have the capacity to make a legitimate income because your health is declining rapidly, or you're in a lot of pain, or you're being told that you're crazy, or you can't find any relief and you're hopeless. Floating on that wave feels really hard. I'm able to go to the beach and float on that wave because I know it's going to carry me to shore. Right. Mm-hmm. But if you don't have that hope, if you don't have belief in that system that's carrying you, then I can understand how things could get really desperate.
Right? Yeah. So how do people begin to like name and process this kind of invisible grief? Like, how do you name that?
Hope. Community helps. Being seen. I think everybody needs a therapist to be able to talk through really difficult things, because so often I don't go a day in here without helping somebody recognize that what they're experiencing is grief, and they didn't even think about connecting that name to it, right? And it happens in betrayal or loss of relationships, or even if you leave a job for your dream job, you're still going to grieve what you left behind. And the hope, grieving hope, grieving the idea of something working out for you is a really difficult thing because it is intangible and it's something that not a lot of people can understand. And so I think identifying it in communication, but again, if somebody's isolated and if they don't have community, that's one of those things when I love self-care, obviously, but in the very popular social media push for self-care, every once in a while you see somebody say, yeah, that sounds great, but what about when I've got nothing else to give myself? We need community. We need people to come up beside us and link arms with us and tell us it's going to be okay.
For me, I know we're in the chronically ill communities are homebound and bedbound and homebound. And for me, it was social media can be good or bad, but for me, it was Facebook groups are where I found a lot of help and a lot of camaraderie. And I've actually traveled with people I've met on Facebook and made lifelong friends. Thankfully, there's virtual therapy options now because a lot of these chronically ill patients are really isolated in their journey. And it's got to be it's a lonely journey for a lot of people.
Absolutely. That makes perfect sense. And I feel like in the absence of validation and connection and feeling seen and heard, being able to find that's really important. There's a really good book called No Bad Parts by Dr. Richard Schwartz, and it's internal family systems. And it talks about how we all, even the worst criminals in our system in the United States of America or all over the world, they developed certain coping skills. It's a pretty radical thought process. It kind of clarifies in the beginning that it's pretty radical. But no matter what crime has been committed, that person created a set of coping skills early on to deal with whatever they were facing. Right. Sure. And that's not justifying crime. That's just helping us understand it in a unique way, in a way that actually provides hope, because it gives us the idea, the conceptualization that there's a rehabilitative component here. If people that hurt people can be healed, then maybe less people will be hurt. And so when you think of this specific case of having medical PTSD, not being heard, feeling hopeless, and the coping skill is extreme, right? Like it was extreme, and it has forever changed multiple lives for sure. It was a permanent solution to a hopefully temporary problem because of advocacy or connection or finding a different doctor, or finding the right therapist or whatever could have helped navigate that situation in a way that had a very different ending to that story. But the reason that it's been such a big story is because so many people relate to him. So many people relate to the guy behind the gun, because so many people relate to feeling not heard and hopeless in their pursuit of feeling better.
So let's go back for a minute and talk about, can you tell us what medical gaslighting really looks like in practice, and then how somebody can tell if they're being gaslit versus just simply misunderstood?
I'll talk about one of my clients, obviously, without giving any identifying information,
Sure.
but she's in her 20s
Mm-hmm.
and experiencing a significant amount of pain for a very long time. And she has been told over and over again, you're too young to experience that pain. And she's, okay, I get it. I'm young.
But it's here.
I'm experiencing it. So I don't understand how that's relevant. It's disappointing that I'm experiencing this at this age, but can we genuinely talk about it? And so I think what happens is that shame is not something that is selective. It's not a selective experience. It's an experience that every single human has. So if a physician, giving them the benefit of the doubt, giving them the perspective of generosity, if a physician feels stumped by a case or feels out of their clinical practice, their capacity, if they feel a little bit of imposter syndrome, we all know that we're capable of using that more aggressive or defensive, oh, well, if I can't figure it out, then there must be nothing wrong with you. And maybe they don't say that exact phrasing, but I think it's probably because nobody wants to not have an answer for a patient. It's not like it's an ideal scenario to be like, yeah, I have no freaking clue what's going on with you. My bad. They're going to feel shame about that. And they're going to be reactive, and they're human beings too. Like no physician is a god.
So being simply misunderstood would look like what instead?
I think somebody that says, hey, I believe you and I know that what you're experiencing is real. And while I haven't found an answer yet, I want to help walk this path with you and find solutions. And if I can't figure it out, at least maybe this is somebody who could give you some coping skills to manage it. Or let's try this pursuit instead. Or I have this colleague who specializes in this realm. Maybe you should set up an appointment with them. Just admitting that nobody knows everything and not feeling like you have to have all the answers to be able to be helpful to somebody.
D's make MDs.
Yeah.
Not every doctor has every answer.
Yeah, exactly. And
maybe there's some grace for that.
Has every answer. I think it's about being curious.
Authenticity goes a long way, even if the answers I don't know.
Yes, but curiosity and authenticity both require a significant level of vulnerability. And so somebody who's really guarded or who has always been, how many physicians are perfectionists?
About the grade. It's about being the top of the class and having all the answers.
Yeah, exactly. So I'm always going to lean into that generosity perspective, which annoys so many people in my world. But it's just, I think it hurts my feelings less when I give people the benefit of the doubt. I take it less personally. I'm like, oh, that reaction, that defensiveness, that mean-spiritedness, that was more about their own struggle with shame and unknowing. That doesn't have to do with me. That's not my fault. I don't have to wear it. I don't have to cuddle up with that dismissive nature because it's not mine to own.
I have a particular doctor that I actually sing in the choir with. He repeatedly gaslit me. I literally had to become the expert and unpack my own health journey. And in this musical that I happened to perform last night, it was a Christ-centered musical. And we had a Christ character that appeared and came through the crowd, took his time coming through the crowd and interacted with us as performers in a very real and authentic and very validating way. And probably one of the most powerful experiences for me was when I looked across and saw this Christ figure grab the hand of this doctor. And I saw the way the doctor looked at him with tears in his eyes. It like all went out the window. It's like, there's a human being stripped of the title, stripped of the emotion, stripped of the expectation, just the raw human being in their pure and divine form. And wow, what if we saw everybody that way? And in an instant, and probably some amends that need to be made there from my end, maybe from both ends, but in an instant, that was gone, right?
Yeah.
When you strip down what matters.
100%. And I think that's a powerful example. I think we also have to consider with medical professionals, with mental health professionals, the reality is that they're wading through people's worst days every day, all day, every day. And so if sometimes we get a little desensitized, then grace is appropriate, but also hopefully some accountability is appropriate from people who can really hold that space with them. I had a friend recently going through a crisis and she really felt like nobody was there for her. She felt like her friends didn't show up for her. Not to take the responsibility of being a good friend away from
Sure.
my plate, but I just said, I'm so sorry that I missed that opportunity for connection, but every single person I talk to every day is going through it. And
Yeah.
so my ability to hold that space for you was diminished. And I'm so sorry. I need to
Yeah.
remind myself that it's everybody's worst day. And just because I might be experiencing a little compassion fatigue or burnout doesn't mean that I don't need to show up for my people.
Sure.
And
Yeah.
so that human component is really important to remember with our physicians, even if they have God complexes. They're still human beings who, if they don't get it right, they feel like shit about it.
Yeah.
Like, that's not fun. It's not
Right.
fun to not get it right. So, yeah, I think that's an important thing to consider here.
What do you think the long-term consequences are in both a superficial and a deep level of being gaslit repeatedly?
It's invalidation. One of the most difficult to manage mental health diagnoses is borderline personality disorder. And the criteria, or usually where that stems from, that grows from chronic invalidation. So when you've been told repeatedly that you don't matter, or that you're wrong, or that you don't know what you're talking about, or that your experience is invalid, one of the most difficult to treat and manage diagnoses is born from that. So I think being told you're wrong or being told you're crazy or you don't know what you're talking about is deeply painful. And it changes the way that our brain even literally looks, because trauma structurally changes the brain. But it also changes the way we show up in every relationship. You become very untrusting. You struggle with your own capacity to be vulnerable enough to commit. You don't believe that people are going to be there for you. And you really question your own worth. And the shame that seeps out of you in that state can be very paralyzing, especially from a place of building community or pursuing healing.
What can somebody do in the moment in a medical appointment if they're being invalidated? The follow-up to that would be, how can patients prepare emotionally and practically for medical appointments to protect their peace?
Yeah, I think on the flip side, so Brene Brown talks about the living big perspective, boundaries, integrity, and generosity. And so, yes, if we're going with the people are doing the very best they can, I'm going to give them the benefit of the doubt. I'm going to believe that he's a human, she's a human, and this is just a manifestation of their own insecurity or imposter syndrome, right? But we also have to have boundaries, because we can't just endlessly be generous. Boundaries, a simple definition of boundaries is what is okay and what is not okay. And everybody has the right to say, I don't appreciate the way you're talking to me. You're making me feel very unheard and unseen. I get that you don't have an answer. I get that you don't have a direction or a treatment plan for me right now, but there's no reason to make me feel small. You can also walk out of the appointment. You don't have to wait for their permission. You can get a new doctor. You could get a second opinion. I think
it's okay to set boundaries with your medical staff.
You absolutely should set boundaries with your medical staff. I recommend with people all the time, especially people who have like white coat syndrome, they get really stressed out when they go to appointment, to have notes. Know what questions you want to ask before you even go in there, and know what boundaries you need to have. Know what is okay and what is not okay with you in that moment, and ask meaningful questions. Maybe if they're saying, hey, I think an antidepressant could help with this, and that immediately makes the person feel like, oh, then I'm just a crazy person. This isn't real. Ask meaningful questions. Tell me the science behind why you think that's going to help with my pain. And you can ask clarifying questions like, do you think I'm making this up? Does this mean that you think it's not real? And I'm sure most cases, the physician would be like, that is not what that means. Somatic does not mean fake. I believe what's happening. I just also believe that serotonin management and producing and controlling the way that your brain chemistry is working is going to have a direct impact on the way that you experience pain. That's scientific. And so while their tone, or while the way that they skim over it or just throw a script at you feel invalidating, maybe that's not really where they're coming from. So asking those clarifying questions, and also if they really are just invalidating you, gaslighting you, you feel like they are not being human with you, then you can absolutely leave and you can say, thank you for your time. I respectfully disagree, and adios, muchacho. I'm going to go find somebody else to talk to because you're not good for me. We wouldn't stay on a first date if we were being invalidated and gaslit. We wouldn't stay at a coffee date with an old friend if we were being talked to like that. A doctor is no different. We have every right to take up space and to be heard and to be treated with dignity and respect. And if you're not getting those things from any setting, not even just the doctor's office, but from anywhere, step away. Step away from that. Don't wear it like Velcro. Don't cuddle up to it. Release that and go find a different place, a different setting where you can feel heard and seen. And I'm so grateful that you found that in social media and on Facebook and with other people who are feeling lost. The fact that you guys linked arms together and found the information you needed to pursue your own healing, that's so beautiful. And I think that is one of the many benefits of our very interconnected world and social media. But when you're not finding that in the four walls of that doctor's office, then leave.
And now, a word from our sponsor. Attention metalheads. Are you struggling with skin rashes, joint and systemic pain, or fatigue that just won't go away? Type 4 metal allergy is often overlooked as a culprit in many of today's chronic illnesses. Get to the root of the problem with ELISA testing. ELISA is a scientifically proven and clinically validated test that measures immune reactivity to metal allergens like nickel, cobalt, and titanium. With fast and reliable results, you can get the answers you need to find relief and live a healthier life. Don't let metal allergies control your life any longer. Visit melisa.org to learn more and schedule your test. Trust us, you'll be glad you did. Melisa, a valuable diagnostic tool in medicine. And I don't want to invalidate the power of community, but I do want to go back to, even though I have been fortunate enough to find that community, I'm just going to speak in the first person here.
Yeah.
I still have very real medical trauma, and this isn't maybe provider based. This is situational based. I've had 47 surgeries now. And any time that I feel this new pain or that new pain, very self-aware of my body, it brings up I just got my health back. Am I going to go all the way back to being bedbound or housebound and having to walk through those triggers? So we have the institutional betrayal that we need to overcome, but then we've got maybe the betrayal of our own expectations on our lives, or just the situational, like the repeated surgeries or the repeated triggering that comes up when you've had a chronic health issue. And I know that you're an EMDR therapist. I'd love to speak for a minute about that, because I was just unpacking my own trauma medically when COVID hit. And then there's insert a whole new medical trauma with COVID. But I had worked through with an EMDR therapist a really bad phobia of flying. And it worked so well that now not only do I not have to be medicated or grab the walls on a flight, but I'm almost thinking of getting my pilot's license. Like, that trauma is gone from my body. So you might want to talk about how we overcome the institutional betrayals and how we can overcome the chronic triggering.
Hey, I love that you brought this up, because what I think is so important, and it goes back to in the beginning when I was talking about neuroscience, there is too much evidence that this is all interconnected to think that somatic means not real, right? Okay, so chronic pain activates the hypothalamic pituitary adrenal systems. So when you've experienced that many surgeries, because every surgery is trauma, period. You're getting cut on, you're getting put to sleep. That is a traumatic experience.
And the brain is still active even when you're asleep to some degree.
Yes. And so it is a traumatic experience. You might be numb to the pain, but your brain is experiencing what is happening. And that is scary. Being filleted open and resituated and fabricated objects being put into your body, like, it's a lot. Like, it is trauma every single time it is. And again, is it the level of trauma that creates PTSD? That totally depends on the person experiencing it, right? We cannot have a blanketed statement that this is trauma, this is PTSD for this person. It's based on that person's capacity to experience that. But when you have trauma related to pain, then it activates that HPA axis, that part of your brain, and that increase in cortisol, that stress response in and of itself changes and heightens your experience with pain, because it makes your limbic system hyper aware of what's happening, and it sends you into self-preservation mode. So you're out of your prefrontal cortex. You are not emotionally regulated. You are not using meaningful language. You don't have the capacity to learn new things. You are going through it, right? That reality, when your brain is in that space, pain hurts more. And that's not fake. That's real. That is not just perception. That is science. The way that your brain is firing makes you hypersensitive to the experience of pain. And then it's also this loop, right? Where your brain is saying, oh my gosh, I'm hurting. Does this mean I'm going to experience more trauma, more surgery? And so then you tighten up, your blood vessels constrict, your entire cardiovascular profile is different because you're going through a stress response, which then makes you hurt more, which then tells your brain, oh God, am I going to have surgery? Is this another thing? Is this another manifestation of this diagnosis? You have to step out of that loop. And I think mindfulness, and I know every chronic pain person that I mention mindfulness or meditation, they like want to give me the middle finger and they're like, cool, just another person that's minimizing my experience. But the reality is, if we really honor and we really hold space for the power that our brain has to heal our body, to heal our brains, to create new neurosynaptic connections, we have to believe that we can break that loop that keeps us in that stress response and heightens our experience with pain. And mindfulness helps create different cortical thickening. It helps create new neurosynaptic connections that tell us that we are safe. Yes, this hurts, but I'm safe. I'm going to be okay. There is hope, and I can walk through this and I'll survive it. And so then that literally changes that perception of pain. Yes, it's there. And yes, it would be ideal if it wasn't. But just because my shoulder hurts right now doesn't mean that I'm going to die. Because that's what the limbic system doesn't differentiate a stress response between me rear-ending somebody at a stop sign versus a saber-toothed tiger jumping at me and about to eat me. Your brain doesn't have the capacity to determine the difference when you're going through that stress response.
And I find in the community, we're sometimes not only taking on our own medical burden, but we're taking on the medical burden of those in our community that we are empathic toward. Like for me, I've always had this massive fear of death, and that goes into a much deeper conversation. But for decades and decades of my whole life, I've read all the headlines of all the people that have died, and in my own empathic way have literally experienced 1,000 deaths. All of their deaths I have experienced physically, mentally, and probably in my nervous system. And then how do you unpack all that? So EMDR is a very legitimate tool to literally go in and remove that trauma. Yes. Would you tell people who don't even know what EMDR is, what it is?
Yes. And I love EMDR. It's been so miraculous in this office to help people break those loops, to help people break those connections that they have to certain experiences, right? So when we're sleeping at night, if you open somebody's eyelids when they're in REM cycle, your eyes are moving back and forth, right? And that's the period of time where your brain really files away all of the experiences of that day. If it's something that created an exceptional level of pain or stress for you, then your brain is going to hold on to that and store it near the amygdala, hippocampus, that hypothalamic pituitary adrenal axis that I just referred to. It's store it near there because I'll go back to that saber-toothed tiger example. If I know that cave reminds me a whole lot, it smells like, it sounds like, it looks like a cave that had a saber-toothed tiger in it that almost killed me a month ago. I want to latch on to that experience, that sensory experience. So if I experience that again, I know to run, right? And so we invite that stress response, and your brain intentionally holds on to those memories to create an expedited response if we are to face that experience again. Right. And that's great if we're living amongst saber-toothed tigers. But when it's something that doesn't require that excessive release of norepinephrine, cortisol, adrenaline, and norepinephrine, right, then we need to utilize the therapies necessary to move those memories into a part of our brain that provides more of a benign response to it. As much as I would love to be able to erase memories from people's minds, all of those collective experiences are a part of who we are. So what EMDR does is the most important and imperative part of EMDR is creating a safe, calm space. So whether it's my office or a different therapist's office, having familiarity with that space, finding that therapist's voice soothing so that your nervous system is at ease when you're in that space. That's crucial because then we bring up that memory in a place where you feel safe and calm. And then we use eye movements to help the brain store that memory in a place that's associated with safety and calm versus I'm about to die. And so then, it's brilliant. From horrific experiences with sexual assault to bullying experiences to medical trauma. It has been so meaningful for my clients to be able to not exist in that hypervigilant state all the time. Because especially like you said, when you've had 40 surgeries and you've experienced all of these symptoms and different parts of your body. I'm sure your brain has a lot of snapshots that it's storing in that axis, and you have stress responses often.
Yeah.
If not always.
Involuntarily, even.
Yeah, exactly. And sometimes you don't even know. Like I remember once I got this really strange metallic taste in my mouth and I started feeling like I was having anxiety. And I realized I drove by a place that I had a horrible car accident. I wasn't consciously aware of it. It was a total subconscious response. My body had a stress response just based on being geographically in the area.
Yeah.
Our brains are incredible, and honoring the power of our brain is an imperative component of being able to utilize the power of our brain to heal ourselves. Whether it's EMDR, whether it's mindfulness, whether it's cognitive behavioral therapy to change thought processes and to step out of the loop, we do have power. And we can use those things regardless of the medical diagnosis. Any of the work that I do with people who have experienced chronic pain or chronic medical conditions or medical PTSD, it's never to minimize or invalidate the experience. It's just recognizing that we have the capacity to complement whatever treatment plan you're pursuing with medical professionals by maximizing our mental health and by maximizing and harnessing the power that is our brain.
Got it. Yeah. Do you think mental health professionals are being trained to recognize medical PTSD in their clients?
Oh, gosh, I had to intentionally seek that out for sure. Okay. That's why I love that I started in the hospital setting, that I was in ER and labor and delivery for a long time, because I really got to see the impacts of, unfortunately, there is bad care out there and there are people who feel really unheard. And even just being in the ER, being the ER social worker and being able to go in rooms where people felt really invalidated and dismissed and helping explain to them that this is just maybe not the setting for what's going on with you. Nobody's saying it's not real. You're heard, you're valued. We want to send referrals. We want to make sure you get connected with the people that can help you. This just may not be the right setting for what you're experiencing right now. You know what I mean?
That's a really good way to put it.
Yeah, because people want to go into the ER and have all of their problems solved. And
they just keep you from dying, usually.
Exactly. They just keep your heart beating. And if you're having any emergent...
Not the place to get a diagnosis.
Yeah. In the world of lack of appropriate medical coverage, a lot of people try to use the ER for that. And that's a place... The ER itself is a source of such medical invalidation. My mom specifically will not go to an ER because she's been hurt. Like her heart has been hurt. She's been invalidated and she's been made to feel crazy. And I think a lot of the times unintentionally by the medical providers, they're just focused in their realm and maybe they're experiencing a little bit of compassion fatigue, and she's been hurt by that world.
This may encompass some of the other questions that we're talking about, but I do want to ask it specifically in case I've missed something here. But is there something that you see happening in the broader healthcare system that's contributing to widespread patient trauma?
I have a whole soapbox about insurance. I won't take insurance anymore. My practice that I'm officed in, Enzo, they're a direct care practice and they no longer take insurance. I think the paperwork, the number of patients you're supposed to see. I have a client that is a physician that works for a large organization, and the amount of patients that they are expected to see to guarantee their paycheck is absurd.
Yeah.
It is absurd. I'm talking like 27 patients a day in an 8-hour workday. You don't get meaningful time with those patients.
Is that a mental health practice? Because the medical practice I know, there's a certain provider that you and I both know who was seeing 70 patients in her urgent care clinic in one day. 70.
There's no way to have meaningful time with, the person I'm talking about, it's a pediatric setting. And those infant visits, that's not enough time to see people in a meaningful way. And then the paperwork associated, the liability associated, it is...
Or the denial of whole diseases and disease syndromes. Let's take Lyme disease, right? How much insurance coverage is there for Lyme disease? So not having appropriate insurance code or appropriate testing for Lyme disease, we could be here all day.
100%. Whenever I was working in a practice where we did take insurance, adjustment disorder is something that I couldn't justify therapy visits with. If the diagnosis code was grief, that person got 6 visits to walk through grief. They didn't ask what they were grieving, who they were grieving, the gravity of that grief. It was 6 hours to deal with their grief.
What I'm hearing is that insurance and the medical establishment as a whole, as well-intentioned as it may or may not be, has lost the ability to give individual attention to detail.
100%. And also, how often do you go into a physician's office these days and they even lay a hand on you? They even touch you and feel you and connect with you with that energy exchange that I think is so important in the process of diagnosing. It's detached, it's impersonal. We're invalidated all the time as medical professionals by somebody sitting behind a computer saying, no, you're wrong. They don't need that medication. Prove it.
Yeah.
Prove to me that they need it. You know what I mean? It's
Right.
wild. So I think
one of my favorite providers, literally the first thing he does when he walks into a room is gives the patient a hug.
100%. Yes, right. Absolutely. And I think dehumanization, if I had to sum it up in one word, is probably the plague that is affecting our healthcare system.
I think that's a perfect word. For somebody who feels like completely alone and abandoned, and I want to address two groups of patients, and I know we're getting to the end of where we probably need to wrap up, but I think this is really important. I want to get to the patient who can afford therapy and then to the patients who cannot afford therapy or who choose not to for whatever reason. So for somebody who maybe can afford therapy, who feels completely, totally alone and abandoned, what's their first step?
You can. Okay. Going back to social media, like putting it out there and asking people. I get so many referrals from anonymous people posting on the Wise County Moms group or whatever. Hey, I really need a therapist. What recommendations do you guys have? So asking people in your community for a good word of mouth referral. If you do have insurance, you can always call your insurance company and see what therapists are paneled with your insurance benefits. But I think just starting and knowing that therapy is weird and it is inherently uncomfortable on the first session because you're about to be overwhelmingly vulnerable with an absolute stranger. So embracing the discomfort and leaning in is really important. And just like I said, you can walk out of a doctor's office. If you don't vibe with your therapist, find somebody who you vibe with. A silly metaphor, but I always tell people, most people love Chick-fil-A, but people feel really strongly about whatever condiment they get at Chick-fil-A. So I'm a Chick-fil-A sauce girl. So you need to find your flavor in therapy. Hopefully I'm your Chick-fil-A sauce. If I'm not your Chick-fil-A sauce, let's find you a Polynesian therapist and let's get it going. You know what I mean? You just have to find somebody who you vibe with because being able to
find you a fried rice therapist.
Exactly. But for people who can't afford therapy, I think 211 is always a place where you can call to see what resources are in your community. I know in my specific community, there's a couple of nonprofit therapy organizations where there's either sliding scale or absolute scholarship options for people to pursue therapy. There are online forums, there are support groups. You just have to get to know your community and what resources are there and ask questions, ask for help. And I think that's the hardest part is being vulnerable enough to put it out there. Okay, I'm feeling alone. I'm feeling isolated. I need connection. I need help. I'm drowning. Can somebody throw me a life raft? And if you can walk in vulnerability, then ask for what resources are available. I used to tell people this at the hospital all the time. If you don't know a community forum where you can ask that question, or if you don't trust the people around you to say you need a therapist, call a social worker at your local hospital and say, hey, can you give me a list of therapists? Or can you give me a list of mental health resources and help me get connected? Because they're the experts. Social workers are always the experts on local resources.
Take it away from the therapy model for a minute. If somebody is not ready to put themselves out there and be that vulnerable, what are some tools that they can use right now on their own? Don't depend on anybody else. What tools are available? Or do you have a favorite grounding technique or an exercise? What does that look like?
Something that people are always a little bit like, what, Megan? That's weird, my clients. But when you're feeling that stress response, when you're feeling overwhelmed, or when any of your PTSD triggers are pressed, or if you're feeling that heart rate increase, I'm getting flushed, I don't think I'm going to be okay, I'm sweating, grab an ice cube.
Okay.
A temperature shift is really important. The old saying with kids, get them outside or get them in water, that works for us too as adults. I'm a big fan of a cold plunge. There's a lot of really beautiful science or research that attaches healthy pursuit of dopamine for pain management. It's a path forward.
I'm such a chicken. I can't do a cold plunge. I'm always freezing. I don't have a thyroid.
Totally fair.
That sounds like hell to me. Get it? I get it. But if I ever do it, we'll put it on the podcast.
Perfect. There are a lot of other options for temperature shifts, putting your feet in the grass, holding an ice cube, taking a warm bath, anything that brings your brain back into the prefrontal cortex. So like a sensory experience that brings you back into the prefrontal cortex.
Somebody was always telling me, and I'll probably get it wrong, but you can get it right. Name 3 things you can touch, see, and smell.
Yeah, the 5, 4, 3, 2, 1. So you can
how does that work?
You can do any version of that, but 5 things you see, 4 things you feel, 3 things you hear, 2 things you smell, and 1 thing you taste. If you can't remember that exact pattern, then just getting plugged into your sensory experience. Eat a sour candy, eat a peppermint, grab an ice cube, get outside, feel the sun on your face, experience a temperature shift, get in your body rather than
be present with that.
Yeah, rather than in the story that your hyper vigilant self-preservation mode is telling you is real. And I'm always going to promote a mindfulness practice. Guided visualizations, guided meditation is still what I use. I use the Presence app, the Calm app, Headspace. There's also a million free meditation options on YouTube. One of my premises as a therapist, I go back to, and Dr. Gabor Mate does too. He has a really good book called The Myth of Normal that I think anybody experiencing chronic pain or an elusive diagnostic journey should read that book, because it just helps us feel like we have power in that pursuit. But I think that remembering that we have the capacity to create cortical thickening in spaces that are full of hope and full of groundedness is really important. And I always have to go back to mindfulness. We're supposed to be in the sun, picking berries and having
gathering
and making babies and being in close proximity to each other and being in nature. And that is not the life we live anymore.
Yeah. What can a patient do to help themselves trust again after months or years of being dismissed?
That's tough.
And then actually also, if they're still navigating the PTSD or gaslighting in the middle of their illness, how does that all look and how can they feel safe in their own body again? I guess that's all encompassing.
Yeah, it is. And of course, I recommend therapy for that because it is so broad. That's such a dynamic experience with so many implications, and taking on each of those kind of symptoms or the way that trauma presents in your life individually is important. Yeah. But I think it's vulnerability. I think it's forgiveness. I think it's grief. Grief and forgiveness are really inextricably connected. And being able to say, I'm going to grieve that the medical system failed me before, that I didn't get the answers that I needed, that I didn't get the healing that I really was connected to the idea of. And I'm going to forgive. And then I'm going to walk in vulnerability and try again with a different provider or with a different physician or with a completely different network or thought process. Maybe I'm going to go to a holistic psychiatrist rather than focus on this journey that I've been on. There's just so many different approaches.
I had a spinal tap once and I was in a hospital, and I had one before and it resulted in a spinal leak and this whole big long thing. And I was telling the very smart nurse, and she probably wasn't a nurse, she was probably a doctor, but she was the one doing the spinal tap and you're awake for it. And I was telling her it all happened, and she was just very calm and very reactionary. She said, that was that day. That is not this day. And it was a gentle reminder that what happened before doesn't have to happen again, just because it looks the same, allowing there to be a different day and a different moment.
Yeah, exactly. We don't have to repeat patterns, and we don't have to assume that the system in its entirety is going to be broken forever, because there are good people and there is a wave of awareness. I think there are people who want to return back to that more human model. That's why you see these direct care practices and these like concierge practices popping up everywhere, is because we want to bring the humanity back to medicine.
In closing, is there anything that you think we haven't touched on that you want to leave us with that you think is critically important?
I think the highlights are, even when pain is happening, even when struggle is present, we don't have to give into it. So there's this quote, and I can't even tell you who said it at this point, but when you're thinking about our human experience, pain is inevitable, but suffering is optional. We have to decide, what relationship are we going to have with our struggle? And are we going to be able to procure and hold on to some hope? Are we going to continue to be vulnerable in our pursuit of advocating for our well-being. Because when you give in to the suffering, when your perception is full of darkness and hopelessness, then it's really hard to break free from those chains, from the pain and trauma that you've experienced before. Continuing to put one foot in front of the other and get creative in that pursuit is crucial. Your experience matters. Your struggle is relevant. There are people who care. There is research out there that can inform your journey, and just hold on to that hope, because there's so much meaning in being able to continue to see yourself feeling better, to see yourself getting answers, to envision the clarity that can come with continuing to advocate for yourself. So don't lose that hope. Hold on to it like your life depends on it, and pursue it in whatever way feels meaningful, whether that's in relationships or in your spirituality or in nature. Hold on to hope, because you deserve to feel better.
Awesome. Megan, thank you so much for your insight and your warmth and your fierce advocacy for people who have been told that their pain doesn't matter. I think you've really given us not just hope, but this episode has given some really valuable insights and some good tools for healing. We'll go ahead and link the resources for this episode in the show notes, including how to connect with Megan and maybe some trauma-informed therapy directories, as well as support communities. But I'll remind you that there are also great resources on heavenlymetal.com. We have a resource page there, and if you go there, you can get a free Next Steps bundle and symptom list when you subscribe to the email list and the newsletter. And then stay tuned for great things that are coming up for season 3 in the fall of the Heavenly Metal podcast. And as always, please share and comment on my episodes and also on social media. This really helps grow the message and puts us out there in front of the algorithm. And obviously, share if this message and this episode resonated with you or anybody you know that's left a medical appointment in tears or been told their symptoms or your symptoms were just anxiety. So again, please do know you're not alone. You're not imagining it. You do deserve to be believed. Thank you, as always, for being part of our community and being ones to raise your voice to tell those who would silence us that we're not going to take it anymore. Thank you for tuning in today. Please don't forget to follow me on social media and to like, share, and subscribe. My primary mission is reaching out to others who may be suffering from hypersensitivity reactions to metal implants and pointing them to resources that can assist with hope, help, and healing. If you know someone that suffers from a chronic illness, you might ask if they have any implanted metal hardware and if they've ever had a reaction to jewelry or metals of any kind. Might not even be on their radar. Visit us at heavenlymetal.com, where you can find images and documentation relating to our show today, as well as a number of valuable resources and links to assist you on your own personal healing journey. Until next time, keep on rocking.